Before watching the video, don't forget to click subscribe button below and click bell icon to notify you about publishing new videos.
Channel Natural Treatment and Home Remedies presents video on height influences risk of cardiovascular disease, diabetes, and cancer.
The relationship of the worldwide increase in height with the development of leading chronic non-communicable diseases has been revealed in a new article. Tall people have a lower risk for cardiovascular disease and type 2 diabetes, but a higher risk of cancer. The authors discuss which dietary factors and other mechanisms may explain these associations. Multiple causes are suspected. The authors suspect that the increase in body height is a marker of overnutrition of high-calorie food rich in animal protein during different stages of growth. Thus, already in utero, lifelong programming might take place that until now has mainly been established for the insulin-like growth factor 1 and 2 and the IGF system. Among other consequences, activation of this system causes the body to become more sensitive to insulin action, thus positively influencing the lipid metabolism. Accordingly, our new data show that tall people are more sensitive to insulin and have lower fat content in the liver, which may explain their lower risk for cardiovascular disease and type 2 diabetes. Professor Stefan added, these findings fit in with published data that suggest that tall people have relative protection against disorders of the lipid metabolism. However, this activation of the IGF system and other signaling pathways may be related to an increased risk of certain cancers, especially breast cancer, colon cancer, and melanoma because cell growth is permanently activated, the authors suspect. The result is an inverse association with the risk of cardiovascular disease and type 2 diabetes, but a positive association with the risk of cancer. Conclusion. The scientists advocate considering the factor growth and adult height more than hitherto in the prevention of the above-mentioned major diseases. In particular, physicians should be made more aware of the fact that tall people, although less often affected by cardiovascular disease or type 2 diabetes, have an increased risk of cancer. Hitherto, the importance of diet has been underestimated, especially during pregnancy and in children and adolescents.
I hope you enjoyed watching the video on height influences risk of cardiovascular disease, diabetes, and cancer. Subscribe to our channel Natural Treatment Home Remedies and learn more about new things. Thanks for watching video. Subscribe, comments, likes and share. Thanks.